Switching topics a little bit, when we're thinking about diagnosis, there are some inherited syndromes that predispose people to get neuroendocrine tumors. Maybe James, can you just give us a little bit of a background on what these syndromes are?
So sure, I mean, there are actually a number of genetic cancer syndrome that are associated with neuroendocrine tumors. And our suspicion can be based on, the primary site as well. Because by and large, most of these genetic cancer syndrome are associated with pancreatic neuroendocrine tumors. The most common one probably for pancreatic NET is MEN1. So here I would be suspicious if a patient is presenting with, for example, a pancreatic neuroendocrine tumor and a history of pancreatic neuroendocrine tumor or parathyroid abnormalities, or even just presenting with nephrolithiasis like kidney stones and pancreatic neuroendocrine tumor. Other genetic cancer syndromes that predispose to pancreatic neuroendocrine tumors can include tuberous sclerosis and neurofibromatosis. Fortunately, as adult oncologists, most of the time these patients present far earlier with other manifestations that are already identifying them as having that particular syndrome. And finally, although we think generally about von Hippel-Lindau being associated with clear cell carcinomas of the kidney, they are also actually associated with pancreatic neuroendocrine tumors as well. So that's something we should think about. I think the important thing is, get these patients checked out, and if they have the syndrome, do the appropriate genetic counseling and so forth.
So clearly genetic counseling is absolutely key, both for the patient, but perhaps even more importantly for their family members, so that they can be screened and some of these tumors can be detected. Another question that often comes up, we know that for other cancers now you can do genetic testing on the tumor itself. And for lung cancers, if you find an EGFR mutation, you know how to treat it. For colon cancer, if you have a KRAS mutation, you know how to treat it. Can we use any of this information in neuroendocrine tumors at this point in time?
I think the field is still evolving. For small bowel carcinoma tumors, there has actually been remarkably few mutations found. So I don't think we have anything there. There has been a paper that was published by the Hopkins group looking at pancreatic neuroendocrine tumors. And here they found the most common ones were MEN1 and DAX-ATRX mutations. But also a group of patients had also mTOR pathway mutations. There may be implications for therapy, but these needs to be validated in future studies. We really don't know for sure yet.
Thanks.